We'd like to officially welcome you again to another Mikey Live program. I am your host, Mikey Hutchinson, and we are coming to you live from the Spice Isle of the Caribbean, and that is Grenada. And of course, we always come to you during the week to let you know what's happening here in Grenada and possibly other parts of the world. But for today, we're going to spend a lot of time speaking about here at home, Grenada. So if you're from the rest of the world, we still say hello and welcome. I know that there are non-Grenadians who are always on the program. People who have had some sort of dealings to do with Grenada probably would have visited or have somebody who they have interest in also or business with. And so they always stay tuned to the program. So we'd like to say thank you for joining us as well. To the first-time viewers, hello. And the usual suspects, always never miss a program and are always on, hello to you. Let us take a look at what we will be talking about tonight. The hospitals are not overwhelmed at this time in terms of the availability of beds and so. Nah, they're doing fine. We'll talk to you about that. More beds were added to the general hospital to deal with the influx of patients. Good news again. And the 8 confirmed the COVID-19 deaths at the Hilarion home. We'll talk about that. And Mortuary freezer belongs to a funeral home. And it's raised a lot of concerns, so we'll talk about that. CARICOM leaders concerned about the high increases in the COVID-19 deaths and infections. And Alston, Braveboy, who's 45 years old, is missing. 216 new COVID-19 cases announced on Monday, and over 60 persons in Carriacou and Petite, Martinique positive with COVID-19. So we'll talk to you about that and more when we return from our first break. By the way, we'd like to let you know that the headlines was brought to you through the kind compliments of the Communal Cooperative Credit Union, Coats Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, superb distributors. And of course, we would like to say thank you to Real Value and everyone, all the sponsors of our headline, all right? And so all the other sponsors of the program, in fact. So we're taking our first break and we'll be back. When we come back from the break, it's going to be real news in Olililolo. Remember, it is important that you share the program so that other people get to know that we are live. So go ahead and share the business. And somebody sharing the program will receive some free credit compliments Digicel. And that person could be you. So yes, we are taking our first break and we'll be back momentarily. Stay tuned.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic,
get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer everything loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the Communal. Apply today and take advantage of this exciting offer. Visit the nearest Communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016, or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Customer services, bill payment, revenue collections. It's the official opening. NOASA's Lucas Street headquarters, Tuesday, June 22nd, 2021 at 8 a.m.
Come, we are excited to serve you.
NOASA, committed to meeting customers' needs.
All right, again, so we'll like to say officially again, welcome to everyone currently tuned in. Now, the first thing that we have to tell all you about by CARICOM leaders, they have expressed deep concern at the significant increase in the number of deaths and positive cases linked to the coronavirus COVID-19 pandemic in recent months in the region. Now, the CARICOM leaders, they met in a special emergency meeting virtually on Monday to consider a regional response to the recent surge in the infections, hospitalizations, and deaths due to the pandemic. No official statement has yet been released by the Guyana-based CARICOM Secretariat regarding the outcome of the deliberations, but sources stated on Tuesday that the regional leaders expressed deep concern at the increase, with more than 100,000 new cases and 1,400 deaths between July 21st and September 12th, 2021. You understand? According to the source, those in attendance received an update on the pandemic from the Executive Director of the Trinidad-based Caribbean Public Health Agency, CAFA, Dr. Joy St. John, who noted that since the outbreak in March of 2020, the Caribbean has recorded more than 300,000 confirmed cases with more than 6,700 deaths. You understand? And well, we all know what it is that we are going through here for ourselves. You understand? So, yikes. I noticed there's a young man who is missing, and that information was made available to us by the Royal Grenada Police. But this guy, I think he's a, if I'm not mistaken, is also a Calypsonian. Yes. His name is, according to police, Alston Braveboy, 45 years, of Cafe St. Andrew. Now, Braveboy was last seen on Thursday, 9th September 2021 at his home at Cafe St. Andrew. He's about 6 feet in height, medium built, and dark in complexion. Anyone seeing Alston Braveboy or has any information about his whereabouts, you're asked to contact the St. David's Police Station at 444-7070, Grenville Police Station at 405-3153, Police Emergency at 911, Police Hotline at 444-1958, or the nearest police station. So can somebody confirm for me whether or not he is a Calypsonian? Because his face looks very familiar, and I do believe I interviewed him once, well, no, more, at least twice, about his music. But I do not want to make that statement yet unless I'm able to confirm. Now, I made a couple calls, and the people, they were not able to tell me definitively that that's the Calypsonian. All right, so let's see if we can organize that. All right, so they say he's missing, and I'm hoping to get more information on that, maybe at the end of the program, based on somebody who's watching. All right, somebody's saying that they found him. Well, if they did, I like to get confirmation of that as well, because we did not get any such information from the authorities. All right, somebody say that he has returned, but we don't know that. All right, so we'll talk about it after. All right, we'll talk about that after, because we just received the information from the police today regarding that, and they want us to put it out there. All right. Now, the next thing that we have to tell all boy, well, we received the dashboard late last night, and there were some of you who were on the program, but by the time we gave the dashboard, some of you had already left, although we tell all to stay, you understand, or no, or they don't want to stay. So anyway, yesterday, the Ministry of Health reported a total of 260 new cases of COVID-19. According to the Ministry of Health, the active cases in Grenada at the time, which was yesterday, stood at 2,063. The active local cases stood at 2,055. As it relates to hospitalizations, 68 persons were hospitalized. And yeah, that's a lot. You know, we were told in about 2 press conferences ago that the hospital could only have accommodated just around 50 persons because they had about 50 beds. But we have an update for you on that. We'll talk about that just now. Now, as it relates to deaths, right? The death toll stood at 35 yesterday. Yes, 35. 34 of which died within the last just about 3 weeks. You understand? We are expecting again the new COVID-19 details in a moment, the new dashboard during the course of the program. All right. Now, not only on mainland are we affected, but Carriacou and the Petite Martinique, they're having their fair share of high numbers as well. Over 60 persons in Carriacou and Petite Martinique thus far has tested positive for COVID-19. We hear now from the minister there for CARICOM, Petite Martinique Affairs, Honorable Kindra, Matthew and Stuart, who's going to give us an update as to what's taking place with regards to the numbers in Carriacou.
We continue to monitor our COVID situation here on the islands of Carriacou and Petite Martinique. And yes, the numbers are increasing gradually, they are increasing daily. And as of today's date, I can report that we now have 57 active cases in Carriacou and 5 active cases over in the island of Petite Martinique at the moment. Of course, we are concerned with the rising numbers, but what we have noticed thus far is that the recent cases, the latest cases, are really contacts of previous positive cases. And so it means, therefore, that our contact tracing efforts and activities are really working. In addition to that, we have over 60 persons in isolation pending further tests to determine their status. And so we continue with our sensitization, our PR, our information strategy sharing. And just today, we had another pop-up clinic which saw scores of persons coming forward to be vaccinated and also for testing. I passed there just for a few minutes today, and I can tell you that I was really impressed with the number of persons that was coming in regularly to be vaccinated and or for the purposes of testing. We will continue our efforts to get our people vaccinated, and so there will be another pop-up clinic at the Hillsborough Tennis Court on Thursday of this week for persons interested in being vaccinated and also for the purposes of testing. And then we'll be heading to Petite Martinique on Friday, also for the purposes of vaccination and testing.
Thank you very much for that update, Honorable Kendra Maturin Stewart. Hospitals are not overburdened at this time. That's according to Dr. Taisha Donald, the Director of Hospital Services. All right. Now, today she gave a breakdown of the situation as it pertains to the various hospitals.
So I'll start off first with Princess Royal Hospital. So Princess Royal Hospital today has one admission. A patient who is a centenarian. So it's one admission at Princess Royal Hospital. Princess Alice Hospital, which has a capacity for 12 patients, currently have 9 patients admitted. And apart from the 9 admissions, over the last 24 hours, we had 1 death. At Mongay Hospital, we have 1 patient admitted with COVID-19 who is in stable condition, and they're in preparations to provide a 10-bedded unit where they can house patients who are Mongay patients and also positive for COVID-19.
Now, she also spoke of the general hospital. Now, there were concerns that the numbers were increasing rapidly and whether or not the hospital had the ability to accommodate the rising numbers. According to Dr. Taisha Donald, they have extended the facility and added new beds, and they are now able to accommodate 93 COVID-19 patients there at the General Hospital.
And at the General Hospital, over the last few days, we've had to do a number of, adjustments to increase our bed capacity to cope with the influx of patients to our hospital. So General Hospital right now has a capacity of 93 beds. Over the last 24 hours, we would have had about a grand total of 7 admissions with 3 deaths. Now, our patients at General Hospital, the majority of our patients are unvaccinated, and the majority of our patients have comorbidities, which of course makes the situation a little bit more difficult in terms of prognosis and general outcome.
Thank you very much, Dr. Taisha Donald. We're going to talk more about that in a moment. Now, she also gave a breakdown of the nursing homes. And we're going to talk a little bit about nursing homes, but let's hear what she has to say about the nursing homes that are under the government's care.
We want to speak of our homes as well. So at the Richmond home, we have 13 positive cases in total. Of course, Richmond home houses persons who are elderly. However, because the majority of these persons were vaccinated, they are experiencing mild disease. So they're in stable condition. At the Top Hill institution, which is in Carriacou, there are 4 positive persons in the home at the moment. And right now they're in stable condition as well. So just to give you an idea of what's happening in the government facilities, the government nursing homes.
Thank you very much, Dr. Taisha Donald. Such an articulate woman, right? And detailed. She's also a pediatrician. A pediatrician is how they just call it. And she does well in a private practice as well. And that's my son's doctor. And I can tell you, yeah, she's very precise, very detailed. And maybe you guys should consider, I'm just saying that. So, yeah, because I think, people like that, you need to support. She's really good at what she does. Now, that was the government-run homes. Let's talk about the private homes. 8 confirmed the COVID-19 deaths at the Hilarion home alone. There was a statement that was put out today by the Bishop of St. George's in Grenada concerning the COVID-19 situation at the senior citizens' homes, which are part of the ministry to the aged by the diocese. So the church responsible for them. Says that the Diocese of St. George's in Grenada is responsible for 3 homes. The Hilarion home in Soteres, the Hillsview home at Guave, and the St. Martin home in Carriacou. Since 2020, These homes have been operating under restrictions geared towards reducing the possibility of being directly affected by the COVID-19. And they have largely remained free of the virus, as has most of the rest of Grenada. It goes on to say that unfortunately, the situation has changed drastically over the past 2 weeks, and we are now witnessing the ravage of the virus in all of the homes. Now, as of Tuesday, September 14, this is the current status of the infections in these homes. The Hilarion home that you've been hearing about, St. Patrick, there have been 8 confirmed COVID-19 related deaths, with an additional 2 deaths. Now, the cause of which cannot, they say, be confirmed at this time. Of the remaining 21 residents, 16 are confirmed positive for the virus. 6 of the residents have been fully vaccinated. The complement of 16 staff have been reduced to 6 at the moment, with 10 in isolation at home. 8 of the regular staff have tested positive. Let's talk about the Hillsview home. 2 deaths have been confirmed as COVID-19 related, with 8 residents confirmed positive with active cases, 2 of whom are vaccinated. 6 of the 25 residents have been fully vaccinated. Of a staff of 26, 10 are fully vaccinated, with another 3 having had 1 dose. Of the 7 positive cases, 5 are fully vaccinated. St. Martin's home. No COVID-related deaths have been recorded at the home. There are 7 positive cases. Of the total population of 27 residents, only 5 have not been vaccinated. Okay. They say that they are very grateful to those who have offered assistance in various ways, including those who have sought to keep us informed as to what they thought is going on at the homes. We thank God and our staff for the 18 months we have had without critical problems. In my view, this is not a time for blaming, shaming, or recriminating. It says that the only thing that matters now is to get the situation under control for the benefit of the residents and the staff. Say that we pray that God will give us the wisdom and commitment to meet the challenges and win the battle in the war. Win the battle in the war against COVID-19. They say that we have been working with the relevant health authorities. They have done well, considering the scarcity of the resources all around. It says that with the significant reduction in the staff levels at the 3 homes, maintaining staff to resident ratios have now become a major challenge. We are appealing to anyone who is a registered nurse or caregiver or a retired health professional and is willing and able to assist staff in this crisis. Please contact the Bishop's office 443-5299 or 440-2542 or your parish priest. Our condolence go out to all of those who have lost loved ones in our homes and elsewhere. We thank all those persons who continue to serve as management or staff in these very difficult circumstances. God alone can truly reward them. May God lead us all. As believers, COVID means for us Christ is our victory in disease and distress. Okay. And that's from the bishop. All right. Now, Dr. Sean Charles explained in a very frustrating tone that they, the ministry, including himself, did everything that they could to avoid this particular scenario from taking place?
Now, this is a difficult and tragic one to address, because indeed the situation at many of these private nursing homes is nothing short of regrettable. I remember the Ministry of Health approaching these homes and asking and pleading for the residents and staff to be vaccinated. We were not successful with the private homes. However, the homes which the government has more direct oversight over, we were able to vaccinate the residents. So I am happy that you mentioned two contrasting scenarios. One where we vaccinated all of the residents, and one where there was rejection, there was denial. All right. The persons refused vaccination, both staff and residents, and you have the two outcomes, so I'm asking you to judge for yourself.
That's Dr. Sean Charles. Now, the Minister for Health, Minister Nicholas Steele, says that these deaths were not necessary.
Yeah, Dr. Charles and myself take this personally because we personally reached out to the homes. I personally spent time with some of the managers of these private homes begging and pleading for them to get their staff, themselves, and most definitely their residents, who are some of our most vulnerable in our society, vaccinated, to give them a fighting chance. We were successful in our homes, but the government, as Dr. Charles says. Regrettably, we didn't have the means of implementing draconian measures. I say that regrettably, but I still stand with our decision as a democratic government that we will not implement draconian measures. But the vulnerable persons from those homes, 10 of whom have paid a price. And this was not necessary because we all saw what happened in other homes, in Canada, in the US, in the UK. And this virus is doing what it does. It follows its science. So at this point, our thoughts and prayers go out to those who have lost their loved ones.
These are really tough times. I can just imagine how the family members of these deceased are feeling. The deceased, they have family, they have grandchildren, they have brothers, they have sisters, they have loved ones who place them there for a reason, so that they will be safer, in a better place. Deaths? In a 2-week period? It's just hard to digest. It's just hard to digest. That's somebody's mother. You know what I mean? That's somebody's mother. That's somebody's grandmother. That's somebody's great-grandmother who's been through all of it. And to die like this, through no fault of theirs, they have played their part, have done their part. And where they should be resting peacefully, safely from all of this, we bring this to them. We take their life while we leave to take someone else's again, while we leave to go about our business. I hope those who are responsible, it's not the blame game. Hope those who are responsible be held accountable. Now, there's a lot of talk going around about a freezer or container that's for bodies who die, persons who die from COVID-19. So we went ahead and we did a little digging. It seemed to have raised a lot of concern. Raised a lot of concerns from a lot of people, including workers of this facility, the Mongay Mental Institution. Now, on whether or not this is the purpose of the fridge or of the container, the minister said, yes, he can confirm that it was placed there by one of the funeral homes in preparation to deal with the rising death, the rising death toll as it relates to COVID-19. According to the minister, the funeral home requested that the container be placed on the Ministry of Health's property, and that request was granted. The minister says he hoped that it doesn't get to this, but of course the necessary preparations need to be made. You would appreciate that there are a lot of people, over 35 deaths that would have probably not likely happened under normal circumstances, and that is going in addition to the regular deaths. And so if this trend is to continue, of course, there will be a need for additional storage for these bodies. And so that is the purpose of this mortuary freezer that you have heard about and seen pictures and so on circulating on social media. One of the workers, or someone on this video who claimed to be a worker of the facility, expressed concerns that the mortuary freezer is placed in very close proximity to a kitchen that is used to prepare food for the residents and patients at the Mongay Mental Institution. All right, what else do we have to tell you? We are expecting, again, the COVID-19 dashboard, and any other breaking news we'll be probably able to share with you a little bit later on. We have so many things to tell you, but we are running out of time. All right, so what we are going to do is that we are going to take a little break and come back. When we come back, we've got the national report, we've got the weather, any other breaking news, plus we do expect to have by then the dashboard. All right, for those who exercised patience last evening, they were able to get it even while we were just about to leave. That's when we got it, and there were quite a number of people still awaiting, so they were able to get the first-hand information where that is concerned. So family, let's take a break, and I'll be returning shortly.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330 ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, they easy?
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Summer is ending, but the deals are just beginning with the Court's end of summer sale. Get up to 50% off your favorite items to include patio furnishings, pools, coolers, TVs, mattresses, and more. Plus, shop today with the Ready Finance and pay nothing for 60 days. Take advantage of these sizzling summer deals for a limited time only. Shop in store and online at shopcourts.com. Conditions apply. Courts, bringing value home.
A message by the Grenada Distillers Limited.
You want a hand sanitizer to do 3 things: kill germs, be gentle, and to go where you go. You can get all of that in our hand sanitizer. Hard on germs, gentle on hands, affordable. Remember, hand sanitizers contain alcohol. Keep away from heat and flames and avoid contact with eyes. Available at retailers island-wide.
A message by the Grenada Distillers Limited. Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 143-112-332-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOWASA, committed to meeting customers' needs.
Welcome to Yogo. Most of you know us for our food delivery service and our food pass for free delivery from restaurants. But did you know you can also use us for grocery deliveries too? We've just added another 5,000 plus new items to Yogo's supermarket. And stay updated as we add more products and vendors. Yogo Services is our convenient skip-the-line offering. Let us pay your electric, water, and other utility bills for you. With us, you will be able to buy tickets, pay your rent, schedule bookings, and other services. Need a ride to get somewhere? Give Yogo Lyft a try. Select your pickup location and destination location and wait for our driver to collect you. Never have to worry about how you're gonna get to a place again. Please see website or app for our service locations. And sign up now.
This is the National Report for Tuesday, September 14th, 2021. I am Leslie-Ann Johnson. In the headlines, additional adjustments made to accommodate growing number of COVID-19 patients at the General Hospital. Details to this story and more after the break. And now for the news in detail. Additional adjustments have been made at the General Hospital to accommodate the growing number of hospitalized COVID-19 patients, which, as of Monday night, stood at 68. Recently, increased capacity was achieved through the conversion of the newly constructed neonatal intensive care unit and retrofitting of the pediatric ward. With even more adjustments made to convert the male and female medical wards, the hospital now has a 93-bed capacity, which means there is room to accommodate more patients. The good news is that 10 people have been discharged in the last few days. Giving a breakdown of figures at other medical facilities around the island, Acting Director of Medical Services Dr. Taisha Donnell said a centenarian is currently the only COVID-19 positive patient at the Princess Royal Hospital, while there are 9 at the Princess Alice Hospital. At the Mungay facility, where preparations are being made to set up a 10-bed unit for COVID-19 patients, 1 person remains in stable condition. At the Richmond Home for the Elderly, Dr. Donald says there are 13 positive cases, but the majority are vaccinated, so they are only experiencing mild symptoms. And at the Top Hill Home in Carriacou, there are a number of cases and they are in stable condition. Grenada has 2,646 confirmed cases to date, of which 548 have recovered and 2,063 are active. Of the total number of active cases, 8 are imported and 2,055 are local, with 53% being female and 47% male. Those affected range in age from 2 months to 103 years. The cases are scattered all over the mainland and on the sister isles. 35 people have died from the disease, ranging in age from 18 to 101. Medical officials say all of them were identified as being high risk for severe illness from COVID-19 because of underlying medical conditions. Only 1 of that number was fully vaccinated. Health officials in Grenada are growing increasingly concerned about the low level of vaccination rates in the country. With a population of just over 100,000, only 28% of Grenadians have been vaccinated thus far. As is happening in other countries, a significant number of COVID-19 cases continue to be among the unvaccinated. Statistics from that show that 81% of those testing positive for COVID-19 are unvaccinated. 5% have received their first dose of either the Pfizer or AstraZeneca vaccine, and 14% are fully vaccinated.
To date, we have administered 49,581 vaccine doses. The Ministry of Health rolled out Pfizer on August 23rd and have so far administered 6,574 doses. To further elaborate on vaccination, 29,645 persons have received their first dose, and 19,936 Grenadians are considered as fully vaccinated. We are a population of 113,000, thereabouts. Our eligible population for vaccination, that is, the number of persons in our population that are 12 years and over, is 93,763. So what does this mean? This means that only 21% of those eligible for vaccination are fully vaccinated. We still have a long way to go as it relates to vaccination, as it relates to community protection from COVID-19.
That's Senior Medical Officer Dr. Mayana Charles. She says in the past week there were 1,173 new COVID-19 positive cases, with daily average being 168. 2,063 are now isolated, while 356 are in quarantine. More than 64,400 PCR tests have been conducted to date. Samples are sent to CARICOM for testing, and in the last week, 8 of the 11 samples returned positive for the Delta variant.
What does that mean for Grenada? Now, this variant multiplies far more rapidly in the human body than any previous known variants. In fact, the swabs that we take to detect COVID-19 reveal that people infected with the Delta variant have 1,000 times more viral particles in their upper respiratory systems than those who were infected with the coronavirus that sparked the pandemic in the first place. What does that mean? That means that with every cough, with every sneeze, right, this is packed with that much more virus, 1,000 more viral particles. If you think of the individual particles, let's say as a machine gun, right? The Delta variant is shooting at us 1,000 rounds per second, while the previous or original strains of the virus were shooting at 1 round per second. So this gives you an idea of how infectious and how easily transmissible this variant is.
With such a small percentage of people vaccinated, Chief Medical Officer Dr. Sean Charles is concerned that too many remain exposed and at risk, which is resulting in a steady increase in the positivity rate, which is now around 30%.
Our vaccination coverage is low, and it is low across the board. All right, we only have, about 21% of the population eligible to be vaccinated that are vaccinated. All right, so it means that the whole other, 79% or so, remain at risk. So that it's a dire situation. It's quite a dire situation. All right, that we are facing. All right, and that's why we want everyone to do whatever it is you can to prevent yourself from getting this disease. I cannot state that is enough. The positivity rate has been coming up at around 30%, all right, averaging around 30%. So it means that about just around 1 in 3 individuals who are coming out there to be tested are testing positive. This we have seen repeated in different communities. What is that saying to us roughly? It is possible that up to a third of this population have been infected with this virus. And this is just a rough estimate based on testing that we have done around the island. So it means that it took about 3 weeks for this virus to infect about a third of the population.
Prime Minister Dr. The Right Honourable Keith Mitchell has used Monday's 16th emergency meeting of the Conference of CARICOM Heads of Government to bring his colleague heads up to date on Grenada's current COVID-19 situation. And he also endorsed a call for countries to work closer together in managing the pandemic. Dr. Mitchell shared that Grenada is in crisis given the exponential rate of infections and the number of deaths experienced in recent weeks. He identified a field hospital as one of the pressing needs for the country at the moment, a call which he said was repeatedly referenced during Monday's dialogue. The Grenadian leader said, and I quote, "For many months we witnessed what was happening in other countries, But now the problem has arrived on our doorsteps. And compared to some countries, we are in an even worse position. We are seeing an exponential increase in the rate of infections among the local population, and several deaths have occurred. The situation is dire, and we need urgent support for medical professionals. A field hospital is one of our critical needs at this point in time. I fear that our system is on the verge of being overrun, and we could have a serious problem." Unquote. Dr. Mitchell told his CARICOM colleagues that both health and security personnel are included in the number of infected persons, putting an additional burden on already stretched resources. With the 76th session of the United Nations General Assembly scheduled for later this month, the Prime Minister said it should be an opportunity used by Caribbean countries to lobby for help to address the pandemic. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, Minister for Legal Affairs, Carriacou and Petite Martinique Affairs and Local Government, the Honourable Kendra Mathurin-Stewart, says a contingency plan is being put in place to ensure residents and staff at the Top Hill Senior Citizens Home get the best care possible in the face of positive COVID-19 cases there. Minister Mathurin-Stewart says in addition to the 4 cases recently announced, there are now additional numbers.
We had 4 active cases there. Late yesterday, however, another 4 of the residents were tested positive. In addition to that, many of the staff members, the workers there, also contracted that virus. And so we are, together with the board and the management team of that institution, together with the matron, we are putting together a contingency plan to ensure that the residents there continue to receive the necessary care and attention that they require at this time. We also have 1 hospitalization at the moment. That person is at the Princess Royal Hospital and is receiving care and treatment. And I was advised that overnight that person improved tremendously, and very soon, with God's grace and guidance, that person will be going home.
Minister Stewart has also been making calls for people to get vaccinated. Carriacou currently has close to 60 active COVID-19 cases, while there are 5 active cases in Petite Martinique. She's pleased, however, with the turnout for vaccination and testing at Tuesday's pop-up clinic at the Hillsborough Tennis Court.
We will continue our efforts to get our people vaccinated, and so there will be another pop-up clinic at the Hillsborough Tennis Court on Thursday of this week for persons interested in being vaccinated, and also for the purposes of testing. And then we'll be heading to Petite Martinique on Friday, also for the purposes of vaccination and testing. And I want to use this opportunity to encourage all of our people, those of you who have not yet been vaccinated, to seize the opportunity to do so at this moment. We are where we are, and so we need to be able to get out of it. And the only way we can do so is by vaccination and by adhering to our respective protocols.
Ministry of Health officials are cautioning persons who are affected by COVID-19 to avoid waiting until it's too late to seek medical attention. They have noted that several deaths which occurred within 24 to 48 hours of hospitalization were attributed to persons seeking emergency care at an advanced stage of the disease.
We're noticing that a lot of persons coming in and dying are dying within a short space of time, meaning that persons are ill out there and coming to seek care at General Hospital in a very, tardy time. So by the time they get to the hospital, they're at the advanced stage of the disease. So I just want to appeal to the persons in the public. If you're feeling ill, please call for help. If you're unable to get through to our hotline and you have your own transportation, please come to the hospital. We'll take care of you. We really don't want you to be at home, sick, and not able to access care. And then, of course, come into hospital, when it's very late. So we just want to appeal to persons out there. In the early stages of the illness, if you're feeling fine, it's okay. But if you find you're having any red flag symptoms, as we call them, so dizziness, chest pain, weakness, dehydrated, confusion, please don't wait. Come to the hospital. We'll take care of you.
We should always remember what this disease looks like, what we should look for, because there are many persons in the population that need to be protected. And sometimes we are not paying attention to some symptoms. And as Dr. Donald stated, we have persons that are turning up at an advanced stage when it is very difficult for them to be salvaged. Now, I know that in some quarters, I've heard it being said, persons are saying it's a cold, it's the ordinary post-carnival cold. I've heard the talk. All right, just want to let them know that no, it is not. No, it is not. This is something entirely different, and this is something really serious. All right. Yes, some of the symptoms are familiar. Persons get fever and chills. They get a cough. They feel fatigue. They feel body aches and headaches and all of that. Similar symptoms. All right. They may get a sore throat, loss of taste and smell, runny nose, and all of that. All right. These are the symptoms that this disease is manifesting. However, there are persons who go on to experience what we call warning signs. And when those are present at any time, you need to seek medical care. You need to do so immediately so that we can stem the tide of that we are presently seeing. And those warning signs include trouble breathing. If you start experiencing trouble breathing, this is something serious. This is not something to wait. All right? You start experiencing persistent chest pain. The persons become confused. They're very dehydrated, as was mentioned. All right? It's very difficult to wake. All right? If there is changes in coloration of the skin, especially blue or grayish, all right, the person is difficult to arouse. These are warning signs. Persons, they should not wait. Medical attention should be sought immediately.
And that's the National Report. I'm Leslie Ann Johnson.
Well, thank you very much, Leslie Ann. And what we have for you right now is the weather report. And with the weather report, we see that the weather is expected to be generally fair with brief, light, isolated showers. Tonight's minimum temperature, 24 degrees Celsius. That's reasonable. Winds northeasterly to easterly at 5 to 15 miles per hour, becoming variable to calm at times. Seas are slight with waves 2 to 4 feet in open waters. And that is our weather report. High tides was at 8:21 p.m. and it will be low at 3 a.m. So that is our weather report. All right, what else do I have to tell you? Well, that's it. I am yet to receive the dashboard, and I know it's going to come within the next 5 or so minutes. But what we can do is what we told you last night again. You can send us a message indicating, I know that there are about 2 or so persons who are yet to be added to the group, but we'll do that. Just send us a message letting us know that you want to join the group. In fact, what we would also do is we will, right at the end of the program, we will post the link to the group. You click the link and you add yourself, and then we will be able to send you those updates. As soon as it comes, we send you those updates, all right? So then you don't, it's almost like you're on the program, but you're not, all right? You're going to get not just the dashboards, but any other breaking news that we have, you get it through those groups, all right? And the difference between that group and the other groups is that there's no chatting in this group, all right? We have disabled that feature, so all that happens is that you receive information, all right? So if you want to be part of this, wait for about 5 or so minutes after the program, go back to the page, and you will see the link there. Or you can send us a message, but the easiest thing is to just go back to the page, and you will see, definitely you're going to see that link there. You click it, you add yourself, and that's it. You're going to get the update. All right? And I think that's good. Instead of having you wait for the next 5 or so minutes, we could just do that. Yeah? Okay? So, and what else do I have to tell? I could also post the link in the comment section. So right after the program, if you get a notification in the comment section of this program, well, it will be for that purpose as well. Once you click the link, then you'll be able to add yourself to the group. Let's say hello to a few people who are currently here. Maybe by the time we end, we'll get it in. Who knows? We want to say hello to Sean, Claudette, Shireen, Kireen, Deborah, Brenda, Shumin, Shumshum, Natalia, Rachel, Lorraine, Brenda, more than one Brenda? Hey, what? Who else is with us? Karen, Doris, Kevin, Sally. Hi, Sally. How are you? Vicky, Glenda, Ansha. Who else is there? Yeah, so that's it. Anne and Wendy Ann. Hey, Wendy Ann, happy birthday to you. Happy birthday to you. Happy birthday, dear Wendy Ann. Happy birthday to you, Wendy Ann. I hope that God is going to richly bless you and that your family has a lot in store for you. You're a good kid. All right, so I trust that God is going to continue to bless you. And of course, I wish you success on your endeavors, including your business venture. All the best to you, Wendy Ann. All right, so that's it right there. Okay, good. Not this Wendy Ann, another Wendy Ann. Yeah, we have more than one Wendy Anns on the program, and one of these Wendy Anns has a birthday today. Okay, so that is what it is. Okay, and that's it for tonight. May God bless you and the family. Let's go! In 5, 4, 3, 2, 1, and we all say, ja! No, take care. All the best.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach chairs with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.